Good day, everyone. Welcome to another episode of Collaborative Connections, a space for sharing and learning sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. Today's episode is the first in our Skin Cancer Awareness series. My name is Ericka Clinton, and I will be your host for this episode. On today's podcast, we have Scott White, pilot and skin cancer survivor. Let me tell you a little bit about Scott. He is a third-generation pilot in his family. His grandfather's pilot license was signed by his personal friend, Orville Wright, of the Wright brothers, ladies and gentlemen. His father was a Navy pilot in the Pacific during World War II. Scott grew up around aviation and airplanes, which led to his love of flying. His path to the airlines came as a civilian pilot, and he has been an airline pilot now for 38 years, flying both domestic and international routes. At 61 years old, he has 4 years left in his career before the mandatory age 65 retirement happens here in the United States. So we really want to say thank you, Scott, for taking your time to join us today. It's a pleasure to meet you.
Well, thanks for having me. I appreciate it.
This is a really special episode. Skin cancer affects so many people. And I think there's still this lack of awareness about who's at risk and why they are at risk. So we really appreciate you telling us a bit about your story. I do think most people think about like too much time at the beach, really long tanning bed sessions as putting people at risk for skin cancer, as well as certain skin types. But you were a pilot. When did you first start connecting the dots between being a pilot, flying, and your skin?
Well, I probably have to back up just a little bit because I grew up on the beach in Southern California. So I was exposed to a lot of sunburns as a child. I mean, I grew up in the 80s. In my era of time, we didn't have all of these advanced sunscreens. As kids, it was almost like we had contests as who could be the most sunburned by the end of the day. We would lay on foil blankets and mix iodine with baby oil. And probably the best sunscreen we had in my day was zinc oxide. And even then, you'd only put it on your nose or maybe under your eyes. So some of my damage probably came from my exposure as a child. But it wasn't until much, much later that I started connecting the dots when several of my precancerous areas appeared on the right side of my body, and mostly the right side of my face. And the reason that I relate that to you is that in my 38 years of being an airline pilot, 28 years was spent in the right seat of the airplane. So when you think about that, you hear stories about truck drivers who seem to have a lot of cancer, skin cancer on the left side of their body. For pilots, we're finding out that it's largely dependent on which side of the airplane you're sitting on. And that has to do a lot with rank within the airline business. When you're a co-pilot or a first officer who's the pilot who's second in command of the airplane, that is a position where you always sit in the right seat of the airplane. So that's how most airline pilots start, is in the right seat. As you progress throughout your career, you eventually become eligible to become a captain. Once you become a captain, you're the one in command of the airplane, but you always sit in the left seat as the captain. So when I started thinking about spending 28 years in the right seat of the airplane and some of my cancers appearing only on the right side of my body, that's where I think we started connecting the dots.
That's such great information, but also so interesting of like the place where you probably spend the most years.
Yeah.
Yeah, can signify what part of your body is at risk.
Yeah, and I don't think we related that too much. In my time, we were told that the skin of the airplane protects you. Airliners, any pressurized aircraft, the windows in the airplane are made of multiple layers to give the window strength, because the airliners are, and even corporate airplanes, anything that operates at high altitude, the window thickness plays a very, very big part in the structural integrity of the airplane, especially for pressurized aircraft. We were always told that these multiple layers of glass had a coating on them that protected us from all the bad UV radiation. We're finding out 40 years later that that wasn't the case. And the evidence is being proven now in my generation of pilots, where we're coming up with lots of precancerous areas on our skin. And if they're not addressed, they will turn into cancer. And I've had several. And we can talk about that here in a little bit.
Okay. So I'm assuming with that understanding of this sense of protection by the airplane itself, that you don't wear sunscreen in the
But
cockpit.
no, we never did. We wear short sleeve shirts, and we never protected our faces. Now, if the sun is bright or shining in your face, we have sun visors in the older aircraft. In the newer aircraft, there's big stowable sun shades that will actually shade the entire window. But that provides more of a just a protection from the bright sunlight. It doesn't provide any UV protection. And it'll be interesting to see with this next generation of airliners how the engineers tend to address this. But in my generation of pilots, the ones that are close to retiring, we're all coming up with these strange skin cancers. And we can probably relate it to, where did you spend most of your time? Were you in the left seat or the right seat? In my case was right seat. All my cancer has been on the right side of my body, every bit of it.
Wow. So is anybody taking that on in terms of saying, let's put on sunscreen before we get in the cockpit?
So our newer generation of pilots, so I'm a fairly senior captain at the airline I work for. I fly with a lot of junior, new first officers who are very early in their career, in their 20s and 30s, and they are so educated. It's really nice to see. They all wear sunscreen, they wear sunglasses. If they're not wearing long sleeve shirts, they put on like these portable sleeves that go on their
Uh-huh.
arms. So you can walk around the terminal with a short sleeve shirt on, but when you're in the airplane, you'll see them sleeve up. And I tell them all the time, "Hey, you're a lot smarter than we were." But of course, I think for us, we just didn't have the information. We just didn't know.
Right. There wasn't the education there.
There was
And
not.
obviously they have learned, or the information is out there.
Yeah,
Um,
true. One of the other interesting things we're finding out now is that airliners are subject to cosmic radiation. Cosmic radiation, obviously cosmic, comes from outer space. This type of radiation penetrates the skin of the airplane and the windows, both day and night. It's invisible. We can't see it. It's more prevalent over the North and South poles. So think about this for the international flight crews. A lot of our international flights operate over the North and South poles. At the equator, cosmic radiation is a lot less prevalent. But if you operate in the international environment, like lots of our crews have for their entire careers, we have flight attendants that have an 80% higher chance of contracting breast cancer. And that's something that's only unique to the flight attendant community. Think about, a lot of these flight attendants have been flying international routes for 30 or 40 years. Can we draw a line with that? Possibly. And I think there's a lot of research going into that now. But cosmic radiation was something that was never talked about until recently.
of course, we can't see it. So,
No. And it's not necessarily skin cancer, but it's strange other cancers that people are coming up with. And can we relate that to cosmic radiation? Possibly.
right.
I don't
And
really know
if,
enough about it. It's just been more of a murmuring in the business, really.
well, it's interesting because when you have a rate of cancer that's so high, when you say
Right.
80%,
Right.
right? There's something there,
Absolutely.
right?
And now, can we draw it to UV radiation from the sun? Can we draw it to cosmic radiation? You have to realize there's a lot of electronics on board the aircraft as well. We have radios and transmitters. We have weather radar that's going almost all the time. Could that be a contributing factor? Possibly. And I think our scientists and researchers are looking into that now. But the evidence is coming out in my generation
Right.
after long-term exposure. And it'll be interesting to see what happens 30 or 40 years from now with the kids that are starting in the business now.
It will be very, very interesting to see what things they come up with to make that
Right.
environment safer. Let's talk about your diagnosis and some of the
Okay.
procedures that you
Sure.
had. So
Sure.
you had a very common procedure done with skin cancer, a Mohs procedure
I
on your
have.
face and arm.
That's
And then
true.
you had a carcinoma in your eye.
I did. And this is really an interesting story because it started in my right eye, in the white of my eye. And I was feeling every day like I had a foreign object sensation in my eye. Like you have a piece of dust in your eye or an eyelash.
Mhm.
Every day I would look in my eye and I'd rub my eye all the time and it would never go away. So one day in the mirror, I look and I have this, it almost looked like a light brown spot in the lower right corner of the white of my eye. I thought, well, that's a little strange. I didn't have an eye doctor. I didn't really know who to go to. My dad, who was a pilot as well, who was in his 80s, had just had cataract surgery. His cataract surgeon was a pilot as well, owned his own aircraft. So I thought, well, if anything, he'll know what the FAA certification requirements are if this turns out to be something. I'm going to go see him first. But he was a cataract specialist. He wasn't a cancer specialist. And he looked at my eye real closely. He said, to me, Scott, that looks like something called a pterygium. And I don't know if you've ever heard of a pterygium,
No.
but it's a growth on the surface of your eye that is typically from UV exposure. It's your eye's reaction to many, many years of UV. I've never been very good at wearing sunglasses. Part of the reason is I have very dark brown eyes. My eyes seem to filter light very, very well, that where it doesn't bother me. I have a lot of friends, including my wife, that has very light blue eyes. Sunlight drives her crazy. She has to put sunglasses on the minute she walks out the door. But for me, the sunlight doesn't bother me. So I typically don't wear sunglasses, never have. So this doctor says pterygiums are typically benign. So what we're going to do is we're going to sedate you, and we're just going to shave that little part off the surface of your eye, and we'll send it off to biopsy. He told me, he said, I wholly anticipate this to be benign. Yeah, everyone I've seen has been benign. But 3 days later, I got a call back from the surgeon himself. And usually when you get a call from the surgeon himself, it's usually not good news. He said what it turned out to be was squamous cell carcinoma, and that because my margins were not clear, he would have to send me to an ocular oncologist. And so that was my next step.
Okay. So did it start with the eye and then you realized that there were things going on your face and your arm?
No, my arm was the first thing that had happened.
Okay.
It was my arm first. And I had an area removed in my right arm that turned out to be I had a biopsy first, turned out to be a basal cell carcinoma. This particular dermatologist said, we think we got it all. We're going to keep an eye on it. But if something weird happens or it gets itchy or starts bleeding, which was what was happening over about the next year or so, then I need you to come back and we're going to take a little bit deeper dive into it. During that time, I had a suspicious area in my right cheek area that was actually initially just frozen off with liquid nitrogen, but it kept coming back, and it kept coming back about every 3 months. As I was laying there getting the biopsy in my right cheek after about the third time it came back, the dermatologist looked at that spot on my right arm and said, I really don't like the way that looks. I want to rebiopsy that. That led to me having a Mohs procedure in my right cheek. And also after that led to me having a Mohs procedure in my right arm. Now, my right cheek, I don't know if you can really tell, it's a little bit swollen still to this day, but I had 44 stitches from that Mohs procedure that went all the way under my eye and all the way down my nasolabial fold. That was no fun. And I was very, very fortunate it didn't leave me scarred. I had a very good Mohs surgeon here in Memphis, Tennessee. And aside from it being just a little red and swollen, I've been cancer-free ever since. And that was about 7 or 8 years ago.
That's amazing. 44 stitches in your face.
Yeah. And it had come back after that. They're not sure why. I ended up having to have another Mohs procedure in the same area that wasn't quite as invasive. The second procedure, I had about 20 stitches, which was really no fun having to have that procedure repeated. But now I've been cancer-free for about 8 years. So I think at this point we can probably assume that we got it all. But some of these Mohs procedures can be very invasive. But I feel good now and haven't had any problems since, aside from a little bit of redness and swelling. But outside of that, I can live with that.
Okay.
It's better than the
Okay.
option of having cancer, right?
Absolutely better than the
Right.
option. And
So the skin cancer happened first. The eye cancer was the very last thing to happen.
okay.
Yeah.
So that happened last.
It did.
And after everything you went through on your face and your arm, to also then have this in your eye, like, can you talk to us a little bit about just I guess, how that felt in terms of realizing that there was so much cancer going on for you, particularly on this side of your body?
Yeah, I think there's this big aspect of cancer and skin cancer because that a lot of people don't talk about, and that's the psychological part of it, right? I mean, I did not realize when I had my first skin cancer how invasive a Mohs procedure could be. And of course, they during a Mohs procedure, they leave the wound open to go take the skin sample under a microscope and take a look at it, make sure that your margins are clear. And while the doctor's in the other part of the office looking at that, you take a good look at your face or your arm or wherever it happens to be. It's a big swath that they take from you. And I don't think a lot of people talk about the psychological aspect of that. It's very disturbing. You're shocked as to how much they actually take. But the good news is they take just enough that they need to take without trying to take more so that you do become cancer free. With my eye, I think for me, there was a couple of different aspects for that. One is, am I going to lose my eye? And because that initial cataract surgeon only took material from the surface of my eye, he said that I would have to go for a much larger surgery because at that time they didn't know how much it had invaded the structure of my eye. So your mind typically goes in a bad place of, well, am I going to lose my eye? Has it spread outside my eye? Could it have affected my brain or the other parts of my body? So yeah, I mean, that on its own was disturbing enough. But as an airline pilot, the FAA keeps a very close watch over us medically, and we have to submit to an FAA physical exam once every 6 months. Anything that you have done in between exams has to be declared to the FAA. And now I'm thinking, am I going to lose my career over this? Bad enough to have the cancer, but equally bad to maybe lose my career that I'd worked so hard to get, especially this late stage, best part of my career, best part of most airline pilots' career happens late in their career. And I'm thinking, man, maybe my career is going to be over with. So, so yeah, so I think there's that aspect not just of having cancer, but the psychological part too. And how's it going
Yes.
to affect your daily life? I mean,
Right. I
so
mean, even just thinking you could lose you love doing the most, which is
right
flying.
now, I was
Besides the
very
fact. Yeah.
exactly, and most airline pilots, you fight really hard to get to the major airline level, and so much of your career for the next 30 or 40 years depends on your health. If you lose your health, your career's over with. It's not
Right.
quite like working in a cubicle where, okay, I can come to work sick, or I could lose an eye, or I could lose something, and I could still come to work. In the airline profession, that's not the case. So
Which also, which then in my mind plays back to the fact of where's where's the FAA in this conversation about protection,
well,
right?
the FAA has taken a much greater stand on this. And because the demographic of the pilot group is coming up with all of these cancers. And so the FAA
Yeah.
has taken notice. So the FAA definitely advocates for protection. They have gotten much, much better about advocating for protection. And that's not just being clothed better, but using sunscreens on the flight deck, wearing protective eyewear on the flight deck. So, yeah, so I think there's definitely been a push for more information getting out there to the pilot group so that we know. Because in my day, like I said, we didn't know.
Well, more progress, more information, more
Right.
care, which is
Right.
important. Thank you so much for talking about the kind of psychological aspect related to
Sure.
treatment. I mean, I think I know this personally. I have a client who doesn't think she has cancer because she only has
Mhm.
skin cancer.
Right.
And she goes through these procedures, most procedures, a lot with
Yeah.
very deep removal of lesions and things that her dermatologist doesn't like what they look like.
Sure.
Um, and I think there's this sense that, well, you're not going to have the chemotherapy and radiation that other people have. It's just a little surgery. It should be fine. But I think, as you mentioned, although the procedure is highly successful, and we are grateful for that, it can also be really overwhelming and possibly disfiguring.
Absolutely. And some of these most procedures, not only can they be disfigured, but they take a long time to heal for a lot of people too, you know?
Yes. Yeah.
And the next step is, even if you've had a Mohs procedure, keep a very close eye on yourself. I had a Mohs procedure and the area came back. So just because you have a Mohs procedure, one of these more advanced procedure, doesn't mean that you're going to be. So keep a close eye on yourself. That's probably my biggest advice to people.
Always be on the lookout, so to speak.
Absolutely.
What surprised you most about the recovery? Was it how long it took? What was
Yeah.
your skin like after the procedure?
Oh, sensitive. It was strangely sensitive and numb all at the same time. It's a strange thing. I think anytime they operate on you, your nerve endings are growing back together and your skin is trying to figure out how to rebuild itself. And in my case, it was right on my face. I think for men, the difference between men and women is a little bit different, right? Men, it's almost cool if we have a scar, right? It's like, wow, look at that. You should get in a bar fight. Yeah, you should see the other guy. But right. But for women, not so much. Women are held to a little bit of a different standard, right? We're allowed to get older. I'm allowed to have gray hair. I get more wrinkles, I become more distinguished. But women are held to this, what I believe is a standard of they have to maintain their youthful appearance at all times, right? So I think for women, it could really be devastating, especially in an area that's very visible. So there might even be a little bit of that. But for me, I didn't care. I mean, I am a little bit vain. I'm not going to lie. I'm a little bit vain, but it was upsetting to see what I looked like after the procedure. But I healed over time, and today I feel good about the way I look. But yeah, there's definitely, like I say, that psychological component of how's this all going to turn out? Because boy, when you first come out of the surgery, you don't look very good. But the body does do this amazing job, especially I think on your face, because your face is so vascular. It does this amazing job of healing itself. And I was
Yes.
very fortunate. I was very fortunate.
Thank goodness for that.
Yeah.
Because also I was just thinking as you were saying it, I was like, if you have this procedure on your arm or your leg, you can cover that. When
But your
you have
face
it
is
on
a
your
different
face,
story. Yeah.
right? This
Right.
is how you interact with the
Right.
world.
Now my
And
eye, I will tell you with my eye, I was very, very fortunate. I live in Memphis, Tennessee, where we have St. Jude, one of the very leading cancer hospitals in the United States. And although they have a very large pediatric presence, they also have an adult presence as well. And a lot of the doctors that practice at St. Jude also have adult practice as well. And I was very lucky to be referred to an ocular oncologist who is also, I believe, an oculoplastic surgeon. And this individual is exceptionally talented and he's very, very well known. And I was very lucky to be referred to him. He successfully removed all of my cancer from my eye. Now, I left that procedure. That procedure it was an outpatient procedure, but I was sedated very heavily for that. And I didn't feel very good when I woke up, mostly from the anesthesia. But I came out of that surgery with 10 sutures in my eyeball. And although these sutures, they dissolve over time. They don't have to go in and remove them. They just dissolve over time. It was uncomfortable for sure. What's funny is today, to the naked eye, you can't see the scar on my eyeball, but every 6 months I'm followed by my ocular oncologist. And under a microscope, he'll have other doctors look at my eyes well, and everybody says the same thing. They said, "Oh yeah, there's your scar." Now you can't see it; you would never notice it on me. But if you look if you have one of those slit lamp exams like they do in the optometrist office or something, you can see it like that. But I was lucky visually with my eyeball surgery that there was no real long lasting scars, if you will. Like nobody would notice that I had surgery in my eye. So
that's amazing. And of
that part was
course,
kind of nice. The bad part is I asked him in my last appointment, I said, "Will there ever be a time where you won't follow me?" And he said, "No, you will always be followed. You do
okay.
have one of those cancers that can come back." And I've been cancer free with that one now about 6 years. After that surgery, I did have to do a topical interferon eye drop it's kind of like doing a topical chemotherapy that he said really reduces your chances of the cancer coming back. And thankfully, so far, I've been cancer free, but I am being followed every 6 months. The FAA knows that I'm being followed. And aside from having to submit some extra paperwork to the FAA each year, I'm allowed to continue to fly, which is nice.
That's wonderful. That's wonderful.
Yeah.
Your sight was maintained. that
Yeah,
allows you
they
to say why.
are fortunate. I have 20/20 vision. I'm 61 years old. I don't even have to wear cheaters. So it's just all my friends that are my age are wearing cheaters and borrowing their wives' cheaters. And I have great vision. I'm super, super fortunate.
So, in terms of healing, is there anything that you wish someone had told you about what the healing process would look like?
Yeah, what's interesting is in my case, there was no talk about the healing process prior to the procedure being done. And I really had no idea how invasive it could be. Now, that may have changed in the past several years since I had my procedure done. I remember walking out of the clinic all three times thinking, wow, that turned out to be a lot more than I thought it was going to be. And mostly because it wasn't discussed prior to the procedure being done. Now, like I say, that might have changed today because the procedures I had were several years ago.
I get the sense working with people with cancer that there's still so much that they don't get told.
Yeah.
Um,
And I'm
and
almost wondering, is that because they don't want to scare you I mean, having cancer on its own is scary enough, but having to face a procedure to hopefully eradicate your cancer, yeah, I mean, it's a lot. And maybe they don't want to tell you because maybe they're afraid you'll change your mind or maybe not want to have the procedure. Or, I mean, you find yourself making choices, right? And
yeah,
so, but I know in my case, the procedure and how invasive it could be was really not discussed beforehand. And I think in the Mohs scenario, maybe it can't be because I think with Mohs, they're not quite sure how much they have to take, right?
right.
So there could be some of that too.
And it's a lot to have to share with someone who's
Oh
already
yeah,
been told that they have this very serious illness. But I also know that that can be part of what becomes more traumatizing for people is
sure,
not knowing or feeling again like there is no agency, right? There are no
right,
choices. You just
right,
have to go down this path.
yeah,
Um, and I
yeah,
I think I think there could be a middle ground.
yeah. No, I agree. Now, the one bit of advice that my dermatologist told me, and it's held true for me, is if your body is making skin cancer, it's going to make more. So the big thing is just always, always, always keep an eye on yourself. Go in and get your skin checkup once every, I think my dermatologist recommends once every 6 months, but whatever your doctor is recommending, just keep a really close eye on yourself because if your body's making it, it's going to make more.
So, post skin cancer, besides that really amazing piece of information, is then always be on top of knowing what's going on in your skin,
Sure.
and getting your regular checkups and follow ups. Do they also give you advice about like what to use on your skin, what to avoid?
Oh, yeah,
Okay.
absolutely. What to avoid, what to use, what they recommend. Absolutely. And the sunscreens have become a lot better, right?
Yes.
Now, I'm married to an esthetician, so
Hmm.
I'm very informed as to what's out there. She is on me all the time
Okay.
to wear sunscreen. And you know what? I don't know if I'd be as informed if I wasn't married to an esthetician to tell me all these things. And
Hmm.
I see her in her practice always giving that same advice to all of her clients. And we're lucky today we have a lot more options to protect yourself. We just didn't have that when I was a kid or as a young adult. It didn't exist.
Well, let's talk about your wife for a second. As you said,
Sure,
she is a trained
sure.
esthetician.
She is.
And did her knowledge just help you navigate this process um, in her professional role, but also,
Oh, absolutely. And she watches me like a hawk too, you can imagine. But she watches all of her clients, not just me. It's I know that's a very big part of what she does, not just providing some of the treatments that she offers, but she also keeps a very close eye on all of her clientele. And if she sees something she doesn't like, she refers people all the time.
okay. And is that
So
is that something that you think estheticians understand that they have this responsibility to
I think
ensure
so.
that?
I think now, from what I understand, I see and hear my wife talking to a lot of her professional friends, and that seems to be a topic of conversation quite a bit.
Good, good.
Yeah,
All right. One last question.
certainly.
What would you say to other pilots who haven't thought about this as a concern?
Well, I would say go get checked. keep a really close eye on yourself. The problem for pilots is that we all have this fear that if we report something to the FAA at our next medical exam, we're going to lose our medical certificate. And if we lose our medical certificate with the FAA, we become unable to operate an aircraft. And most pilots don't want that to happen to them. So I think there's this little bit of this fear of going and getting looked at or going and getting checked, because now if you do that, that's a reportable event. And maybe that could jeopardize your profession. But I think, like I said earlier, the FAA has become a lot more understanding with this type of stuff. And my biggest pitch to people is just keep an eye on yourself, because I think pilots, we're very, very good at thinking that we're in control, because typically in our profession we are, but stuff like this can pop up. And if it does, if you let it go, it can go from being something that would be very easily treatable to something that could be devastating. As if you see something, say something.
Good advice all the way around.
Well, thank you.
Regardless of where you work, if you see something, say something.
Absolutely.
Thank you so much, Scott.
You're welcome. Well, thanks for having me today. It's been nice talking to you.
We really appreciate all that you've shared. And I know that the folks who listen to this podcast just got a wealth of information that they probably didn't anticipate by tuning in today.
Well, thank you for having me. And I'm glad to share what I've been through, and hopefully some of my knowledge gets passed on to other people through the process.
I hope so. Well, collaborators, have a great day. And I hope you enjoyed today's podcast.